The member from Kenora-Rainy River.
Today, I would like to draw attention to the healthcare situation in the Northwest, described as being in dismal crisis by a Kenora physician. Over the past several weeks, I have heard from physicians, nurses, and patients in Kenora who describe health policies that are failing Northerners. I've heard about the antiquated Lake of the Woods hospital that has parts still in use today that were built shortly after the First World War and whose surgical room has tiles falling from the walls. I've heard horrific true stories about Kenora patients who, in an effort to free up limited hospital beds, are discharged from hospital to look after themselves until they die, but who have such advanced dementia that they lack the capacity to do so. And I've heard from a Kenora man who received a $1,600 hotel bill after being sent the 5.5-hour trip to Thunder Bay for emergency health care rather than the much closer 2.5-hour trip to Winnipeg where they could stay with family. These stories are not one-offs. They are very much representative of the healthcare challenges people living in the Northwest, in particular Kenora, have to face on a regular basis. All Ontarians, regardless of postal code, deserve healthcare that is close to home. We are calling on this government to fix the healthcare deficit that exists by allowing patients west of Thunder Bay to be seen in Manitoba and by constructing a new, state-of-the-art and fully functional hospital in Kenora. Thank you.